We did our project on the wrist because it is such a big part of our everyday lives. The following video demonstrates just how important the wrist is in daily activities.
Look at the flick of that wrist. 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 Look at the flick of that.
The wrist joint is created by the distal end of the radius and ulna and the proximal row of carpal bones. The radius is the long bone on the thumb side. Where the radius, ulna, and carpal bones articulate is where most of the movement of the wrist occurs. There are two main groups of muscles that contribute to motion in the wrist: flexors and extensors. When you flex your wrist, the flexor muscles contract. The flexor muscles are the flexor carpi radialis and the flexor carpi ulnaris, which both originate on the medial epicondyle of the elbow and insert on the volar aspect of the hand. Extensors are the muscles that contract when you extend your wrist. These include the extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. Extensor muscles mostly originate on and around the lateral epicondyle of the elbow and insert on the dorsal aspect of the hand. The wrist has four main ranges of motion: ulnar deviation, radial deviation, flexion, and extension. Ulnar deviation is the motion produced when you wave your hand toward the ulna, and it can also be referred to as adduction. Radial deviation is the motion produced when you wave your hand toward the radius. It can also be referred to as abduction. Flexion occurs when you bend your wrist down, decreasing the angle between your wrist and the front of your forearm. Extension is the opposite of this motion and occurs when you are bringing your wrist back toward the back of your forearm.
Flexion, extension.
Radial deviation, ulnar deviation.
Radial deviation, ulnar deviation.
We're going to show you some common exercises to work on wrist stretching with active range of motion. Active range of motion is when you're actively moving your own parts instead of passive range of motion, which would involve someone moving your body for you.
For flexion exercises, you'll flex your hand and gently bend your wrist forward, and you hold for 5 seconds. And then you'll repeat 3 sets of 10, like this. For extension, you gently bend your wrist backward and hold for 5 seconds. You'll repeat this motion 3 sets of 10, like so.
Now we're going to look at some exercises that can be done to work on wrist stretching as well.
For the wrist rock stretch, you put your hand out in front of you in the handshake position. Then you'll make a fist with your injured hand. Tuck your thumb inside of your palm. Gently move the wrist from side to side. Hold 5 seconds each way, and you'll repeat 10 times for 3 sets. For wrist stretching, for flexion and extension, you can help bend the wrist down by pressing on the back of your hand and hold for 15 to 30 seconds. After that, you'll stretch it backward into extension and press your fingers backwards and hold for 15 to 30 seconds. And you'll repeat this 2 times. For extension stretches, you can also stand at a table and put your palms down with your fingers flat and your elbows straight. If you lean your body weight forward, this will be an extension stretch. You can hold it for 15 to 30 seconds and repeat 2 times.
Mm-hmm.
For flexion stretching, you stand with the back of your hand on a table, palm facing up, with your fingers towards your body and your elbows straight. If you lean away from the table, you'll have a flexion stretch. You can hold for 15 to 30 seconds and repeat 2 times.